In our office, we specialize in the treatment of neck pain, back pain, and sports injuries. But one thing people don't realize we treat is vertigo. And if you've ever had vertigo or vertigo-like symptoms, you know how awful of an experience it can be. So you will do just about anything to try to find some relief. Now, there are several different things that can lead to vertigo or vertigo-like symptoms, but we mainly treat two types of vertigo in this office. We're going to go over one in this video, and we're going to go over the other one in a separate video, so be sure to watch that. In this video, we're going to be talking about cervicogenic vertigo. This is vertigo that has its roots in the cervical spine, aka the neck. So your neck is very densely supplied with position sensors, okay? So it's these little nerves that are responsible for telling your brain where your body is in space. So ideally, your neck moves really well and sends the proper signal to your brain. Now imagine your neck isn't moving so well. Maybe the joints in your neck are a little stuck, or the muscles in your neck are a little tight. This could be due to several reasons. We see this as a result of postural stresses during the day. Maybe you've had a recent motor vehicle accident or sports injury. These are different things that can cause the joints of the neck to become stiff or the muscles in the neck to become tight. And when this is the case, you're simply not going to be able to move the neck quite as far as you typically could. Your range of motion is going to be decreased. Now, if the range of motion in your neck is decreased and you try to turn your head to the left, let's say you're usually getting 90 degrees of rotation, but because of some joint stiffness and some muscle tightness, you're only getting 45 degrees. Well, your brain thinks, hey, I'm moving myself 90, but you're actually only gonna go 45. This can throw off your orientation in space and lead to some dizziness. Now, with cervicogenic vertigo, we're not getting the same kind of room spinning type sensation that you get with BPPV. We're typically getting this light, floaty feeling, just simply a sense of disorientation within space. When someone comes into our office with vertigo or vertigo-like symptoms, we're going to take them through a series of tests to determine, can we treat this type of vertigo? Is this a type of vertigo that we treat? And if it is, which one is it that we are managing, right? Which one are we looking at? So in the case of cervicogenic vertigo, we're typically going to see loss of range of motion within the neck, stiffness in the joints that we can actually feel with our hands and measure with range of motion, and then tightness within the muscles as well. We'll then move on to treatment. And treatment is really going to revolve around treating that stiffness in the neck. We're going to do some treatment to loosen up those tight joints. That might be an adjustment. Okay, adjustments can be done in many different ways. It does not have to involve the typical pops that we often associate with chiropractors. We're also going to loosen up those muscles in the neck, and then we're going to provide you with some range of motion exercises that you can do throughout the day to help continue that improvement. Cervicogenic vertigo responds really well to conservative care. We typically don't need to resort to prescription medication or any other type of serious intervention. Okay, so if you're experiencing symptoms like we talked about today, we would be happy to help you out. Please visit us online at TruMotionTherapy.com to learn more or to book an appointment.